As states decide for or against restrictions on abortion, you often hear about exceptions that protect the health or life of the mother. Many are asking, how do you define those exceptions? Abby Llorico verifies.
It's an exception written into some policies and laws that abortion is only acceptable in cases of danger to the life or health of the mother. So we wanted to know, does that have a generally accepted medical or legal definition? We talked to a University of Virginia law professor and an OBGYN with the American College of Obstetricians and Gynecologists, who both say no. In law and medicine, what can or should be done to protect the mother is up for interpretation.
It's creating confusion. It's unclear how people are supposed to abide by these laws because they're not written in language that makes sense with the reality of how medicine is practiced.
And Dr. Jennifer Villavicencio says she worries because there's no clear definition of when a pregnant patient's life needs saving.
Every institution is going to look at them and risk analysis them a little bit differently, and people are going to be harmed because doctors are not able to offer the full complement of care unless somebody is on the brink of death.
Professor Naomi Kahn says the laws can give authority to physicians to determine when aborting a fetus is life-saving for the parent, but then it could be up to the courts to determine if the doctor was right.
It is still possible to face prosecution, so to be tied up in the court system. I think the problem will be that physicians will be worried about being prosecuted unless they have engaged in extensive documentation of just what supports their beliefs.
Dr. Villavicencio says even if there were a clear line to cross, she wouldn't want to get that close.
We do everything that we can to prevent people from getting so far to a point where we can't bring them back. And I'm very concerned that these laws are going to push us to wait and wait and wait, and that people are going to be harmed or die.
Dr. Villavicencio says fetal health is important, of course, in a pregnancy, but her patient is technically the parent. With your Verify, I'm Abby Llorico.
And remember, if there's a question you want the Verify team to look into, just email verify@13newsnow.com and we'll work to get you some answers.